Now I'll be going over some short-term goals and some nursing interventions that could be done to achieve these goals. And this will be done in the fourth step of the nursing plan of care, which is usually implementation. The first will be respiratory support. It's very important to intubate and extubate in a negative pressure room equipped with appropriate PPE and preferably powered air purifying respirators. Um, Limit tidal volumes to 6 milliliters per kilogram of ideal body weight and keep plateau pressures below 30 centimeters of water. Higher levels can significantly increase risk of barotrauma. Use fraction of inspired oxygen, positive end expiratory pressure, and tidal volume necessary to oxygenate blood and ventilate patient. And the most important step would be to consider early proning for 16 hours a day to enhance oxygenation. Early proning is very effective because it reduces pleural pressure gradient, improves distribution of ventilation, contributes to alveolar recruitment, and can indirectly decrease ventilator-induced lung injury. Sedation may be required for toleration, and there's not a lot of data to recommend the use of inhaled nitric oxide for every patient. The second short-term goal that could be done will be pharmacotherapy for patients with moderate to severe ARDS and severely ill COVID-19 ICU patients. Short course of systemic corticosteroids, and patients on oxygen up for consideration would use dexamethasone. If unavailable, use prednisone, methylprednisolone, or hydrocortisone. It's also strongly recommended to administer pharmacologic venous thromboembolism, VTE, prophylaxis. If patient develops deep vein thrombosis, DVT, place on therapeutic anticoagulation unless there are contraindications. And it's important to always evaluate hospitalized patients. If they rapidly have increasing oxygen need, then the emergency use of baricitinib or tocilizumab is authorized. Some other considerations that I didn't go over but are equally as important is fluid management, anticoagulation, and the risk of secondary infections.